Alrighty, so if you're watching this, you are getting ready for your operation, and we're talking about your operative day, what you're going to experience. There's kind of two different patients who are going to see us for an operation: body patients or face patients. And the difference is going to be a little different for both. There's going to be something that's different in both. If you're a body patient, I'm going to come in and talk with you, and that means whether you're having a tummy tuck or a breast lift or an augmentation or a thigh lift or a butt augmentation or liposuction. When you're coming in for some of those procedures, I'm going to come in, talk with you about your procedure, make sure that we have your procedure exactly as you want it. I'm going to ask you questions about that to make sure we're doing precisely what you want. For example, with implants, we've got the size exactly what you want, that everything's going exactly as you planned. And then I'm also going to draw on you. Drawing on you is a very, very important part of plastic surgery and helping us figure things out from the difference of you standing there in front of me and you laying on my operative table. So when you're there for a breast augmentation or a breast lift, it's important that we use our marks that we do preoperatively at that time right before your surgery to get things placed exactly as we want them. So that's really how that first part of that operative day goes. You're going to come in through our doors, see our nurses, they're going to get you undressed, they're going to put you in a room, and I'm going to come in and talk with you and mark you. Now it'll be slightly different for those of you who are having a face procedure. Still, again, you're going to come in, see our nurses, they're going to start an IV, they're going to get you ready. They may put you in the operative room most often. They will do that because I'm not the one who marks you for things like a facelift. That is done by my facelift tech, and she's the one who assists me in aspects of my surgery. I perform the surgery, of course, but she marks you ahead of time. And she does other things for you in the facelift, like she puts your hair in little rubber bands. In a facelift, she doesn't shave your hair or do anything like that, but she puts it in little rubber bands so that it separates your hair away from my marks so that I can make any incisions I need to easily and do all of my surgery without your hair being in our way. That helps me immensely, and she's much better at that than I am, so you want her doing that. Now, if there's something very specific that you need to discuss with me, then certainly I can be there to discuss that with you ahead of surgery or during the time that she's doing that for us, so that I have all of your questions answered and you feel comfortable and secure that we're doing exactly what you want. Additionally, in the case of a rhinoplasty, you'll usually be in the operating room as well. And since you don't need any marks with a rhinoplasty and don't need any hair prep like you do with like a facelift patient does, I'm going to come in and talk with you about your rhinoplasty, make sure we're answering all of your questions, make sure we're doing exactly what you want. That would be a time to be able to show me pictures and be able to communicate to me what your hopes are. Again, you probably will have already done that at the pre-op visit or at the consultation to a degree, so I could answer questions about photos and questions about what we could achieve. But to remind me, so both of us know as we're going in there that we're doing exactly what you want, you can do that with me ahead of time at the surgical procedure right before your surgery. That's pretty much it. That's your operative day. It should be pretty simple. After that, you'll go home after you've recovered from your procedure. You'll get instructions from our nurses. We'll make sure the questions for your family members have all been answered. If you have any questions that aren't answered, call us back right away. We're there to take your calls and make sure that your first post-operative night is very simple and that all your instructions have been given to you clearly so that you can follow all those and participate in your care the best as is possible.